Is your sinuses causing vertigo or dizziness? In today's video, I'm going to go through exactly what could be causing it, a few things that you should avoid, and two of my favorite massage techniques that's going to get rid of the pressure so you can get immediate relief. I'm Dr. Matthew Posa, and I'm a corrective care chiropractor in Milton, Ontario, Canada. I help people get over their spine-related health concerns so they can live the life they were designed to live. So don't forget to like, share this information with somebody you know needs to hear this. Subscribe to my page if you like content like this and you want to see more. There is a direct link from the sinuses in your head to vertigo. And the reason why they're linked is that because there's adding pressure. It's adding pressure not only inside, but it starts affecting the middle ear. And when it starts affecting the middle ear, then we're gonna get that sense of imbalance. So congestion, anybody who has a lot of symptoms in the front, you're getting the frontal pain, the allergy type of stuff. You might be getting headaches, vision problems, congestion, post-nasal drip. So you're getting the cough and the sore throat. If this is you, then today I need to show you exactly how to start relieving that, how to start clearing that out of your system, and also some of the other things you can do that you should look out for because they could be another reason why it's even happening in the first place. If you have sinus congestion, if you're getting the sinus pains, not only in the top, in the bottom, through here, so sometimes you even feel it through your jaw, you feel it in your ears, maybe you're feeling it through the eustachian tube that's deep inside, you're feeling it in your throat, you're getting the sore throat, maybe the post-nasal drip aspect of it, so you're coughing all the time. So if this is you, you need to look out for a few different things. Number one, is it caused by allergies? Typically allergens or things that affect you, it could be through food as well, that could be causing this. So if you're getting very mucousy, if you're feeling like you're getting that congestion directly after you eat, or sometimes, like in Canada right now, summer is coming, so we're getting blooming of flowers, we're getting blooming, so there's a lot of pollen in the air. And so a lot of people get that congestion. They always feel like they need to blow their nose. So if this is you, that could be a reason why you're getting the vertigo, why you're feeling uneasy. Your balance might be off because it's building pressure. That pressure is affecting the middle ear, and therefore you're getting that sense of imbalance. The other thing that you also need to look out for is, are you getting headaches from it? Because if you are getting headaches, that's telling you the pressure is not going anywhere. So this is where the technique I'm gonna show you today is gonna really help with that. There could be some other issues, structural issues, the way that the sinuses fit. Some people have had accidents and falls where car accidents where their faces hit something, maybe fights, or they've fallen on their face, post-concussive type of issues where the bones have actually shifted and now it's blocking the way that things are flowing. There could be other things like chronic infections that can really cause a big issue. And so making sure that you're checking in with your family doctor. Maybe you've been sent to ENT who have checked inside. Generally, the people that I work with are the people that have tried everything else, and now when they come into the clinic, and then this is where we're gonna check the structural aspect of it, the neurological aspect. Because if we're not seeing anything directly tied to why, so it could be polyps, it could be a bunch of other things. So this is why you check medically first, and then if you don't see anything there, then the next step is to go to a corrective care chiropractor, because then what we're gonna do is we're gonna be assessing to see, are things flowing properly? The first area of your spine that we need to check is gonna be your upper cervical spine. So if that top bone is tilted, rotated, it's not sitting properly, it's actually affecting the way that not only things are flowing in and out, but it starts affecting the eustachian tube, it starts affecting the inner ear. And when we start getting that, we're getting a backflow pressure, and that pressure builds in through the sinuses. And so what we wanna do is we wanna make sure that that's clear. So what can you do at home? Well, the first thing I would say is you need to avoid dairy. Dairy is highly linked to a lot of allergens. A lot of people get the added pressure from the sinuses being full because it just gets gooey on the inside. Your congestion starts to build. And so if you start taking nasal decongestants or you're taking antihistamines because it could be allergies, and you're noticing that's an effect, then you need to figure out exactly what you're allergic to and what you could do and then avoid. But the first place I would start is with dairy, because often that's when you're gonna get very mucousy. And if you're noticing you're getting very mucousy, that is something I would start right away. You just eliminate it, see how you do, and then what you could do is you reintroduce it after about a couple weeks. When you reintroduce it after a couple weeks and you notice right away you get gooey and mucousy, you start to feel that in the not only through the nose, but you might even get it at the back of the throat, then you know you probably do have an allergy. But let me show you two of my favorite techniques. And the first technique is a massage technique that helps drain the body. And we're looking at the eustachian tube and also the lymphatic system. So we want to get your body working again in order to drain it. So the first thing we're going to do is we're going to do 5 to 10 second massage, and we're going to start under the clavicle. So you have the bone at the top here, and you're going to go right underneath the bone. You're going to go almost just to the side of the breastbone. And what you're going to do is you're going to start you're going to do these little circles, little circle in here. You're going to do this for about 5 to 10 seconds. And then we're going to come up a little bit higher. So just above the clavicle bone is a spot right about here. So maybe about an inch up. We want to come right into the side of the neck, and we want to do this for 5 to 10 seconds. That's usually near also the throat. And so this is going to start helping to clear that. So now we're working our way up. And as we work our way up, we're doing this for 5 to 10 seconds. Then the next place that we're going to go is a little bit higher. So we're going to go just underneath where the angle of the mandible is, this part right here. And so what you're going to do is you're going to go right here. You're going to go circles. You're going to do this for about 5 to 10 seconds. Now some of you are going to notice it's very tender there. And if it's super tender there, highly likely that you have something wrong at the top here. And that's where going to the corrective care chiropractor can dramatically help that. And we're just going to go right in here, 5-10 seconds. Now we're going to move into the jaw. So you have the top of the jaw here, and some of you have even noticed that you have that TMJ issue as well. So it is all linked. So what we want to do is we're going to go just south of that part. So just south here. So this is through the masseter muscle. And we're just going to go in here. We're going to do 5 to 10 seconds. Again, we're just doing this little circle. So then what we're going to do is we're going to go up here. So we're just going to go above now where the jaw sits. And right in here, so there's a big muscle here, it's called the temporalis, and we're just going to be rubbing this guy. So for some of you, just the temple area. So we're going to go in here, we're going to do this again, 5 to 10 seconds. Now by doing this, we're moving your ear, we're also starting to free up the eustachian, and we're allowing for that drainage. You would repeat the same on the other side. So we're doing all these points up here and here, so there's 5 points there. And then you can do that for as much as you want to, especially if you're getting the relief. But the next stage to this is to do the facial massage. Now there's holes inside your head. So there's a hole right around here. So you look at the base, so you start coming down your side of your nose, and there'll be 2 holes right about here. You won't necessarily feel the holes, but if you do have sinusitis, you have all that facial pain, you have these issues, you're gonna actually notice that it's extremely tender there. And so what you're gonna do is you're gonna do a corkscrew massage. So we're doing circles, but as we're doing the circle, we're going in. So it's gonna look like this. So I'm gonna start on this side, and I like to do these together. So I'll take your index finger, and we're just gonna go like this. We're gonna do about 5 to 10 seconds. Again, corkscrew, so I'm going in like this, okay? Now as I do this, I actually, even for me, I start to feel a tickle, so it is gonna work. And we're gonna keep going in, and I like do these 5 to 10 seconds. I already feel that one. Then we're gonna come up, and at the top, right where your eyebrows meet, if you come out, you're gonna feel a little divot, and it's usually no more than about here on your face. If you're past in the middle, you've gone too far. So you're gonna come up, you'll feel these little divots inside, right on your eyebrows. And you're gonna go in here and you're gonna do the same thing. So we're gonna go right in here, and we're gonna go right in here, and we're gonna do these circles as well. This one can be also quite painful, especially if you get a lot of the sinus infections, or you're getting and you're feeling quite congested up in here. But you're gonna go in here, again, 5 to 10 seconds. Just go by what you can handle as well. And again, we're doing these corkscrew type of massages, and we're getting in there. One side will be maybe even a bit more tender. And then at the end of that, a lot of the times you're going to start to feel things drain. But the last thing I would say that everybody should do, especially, is to clear your sinuses, to clear it naturally, because you could use drugs, you could go that route for sure, but we're trying to do things naturally. So my next favorite thing to do is to use sinus irrigation. So there's lots of different types of products out there. There's the neti pot where you tip and then it goes up your nose and it cleans, and we're using a saline solution, so we're just using salt. Now the salt, if there's bacteria, there's pollen, there's dirt in there, that'll actually help clear that out. There's other ones that are in a spray bottle. So again, you add your mixture to it, you're gonna squirt it up your nose, it's gonna go up, it's gonna clean, it's gonna help clear. Once you clear this, if you notice that your symptoms have gone away, then you know that it's directly linked to your sinuses. But if you're noticing it's still persistent, you notice that you might even have neck pain, you notice these spots in here again are really tight, this is where you definitely want to go into an upper cervical chiropractor, a corrective care chiropractor. You want to get that area analyzed. You need to see what's going on, where the misalignment might be, and when we clear that area and we do these things, you're going to notice not only is it going to clear much easier, you're going to notice it comes back far less often, but generally your symptoms are going to go away.